Hello folks and welcome back to my channel. Here I thought it was ear stretching that was the topic that we could never run out of things to talk about, but evidently it's also nipple piercings, because I feel like we've had a video about nipple piercings every single month on the channel for like almost a whole year. But we're coming at you with another one because these are the comments that I keep getting. These are the suggestions that folks keep making. So today we're talking all about nipple piercings and breast implants. So for this, I'm referring to any type of breast augmentation, whether you're getting silicone implants, saline implants, under the muscle, above the muscle, any variation on breast augmentation and how that's going to affect your nipple piercings. And the good news is the majority of the time surgeons are doing implants, there's not going to be a direct effect on the nipple. So they're usually not doing too many incisions around it. We're usually not removing the nipple stalk the way we do with top surgery. So the majority of the time, they're not doing too much to the nipple. That's great for us because it means that it's usually very likely we'll be able to pierce them after surgery. Now, how long after surgery we can pierce is one of people's biggest questions, and I'm always going to suggest at least a year minimum. This is because we still want to give that tissue time to settle and relax and heal before we're piercing through it. See, while surgeons may not be oftentimes messing around with the nipple, they're still putting implants in, they're still making large incisions. That tissue still has a very major effect from the insertion of implants, and it's going to take a while for it to heal. It's also going to take a while for it to settle into its final position. Surgeons estimate anywhere from 3 to 6 months before your breasts to sit naturally as they're going to. In fact, one of the most common complaints I see from people is that immediately after breast augmentation, their breasts sit very high up on their chest and their nipples sit really high up, and they look in the mirror and they're like, oh my God, like what did I do? Why does this look like this? And then their surgeons are like, don't worry about it. They're gonna drop and settle with gravity over time. And they do. But if we try and pierce them before they're fully settled, where we place them and what looks like straight and perfect and balanced may change as your breasts settle and they get used to the implants. You go through a lot of changes from how these look when they're very first done to how they settle in. Take a look at this picture of someone's before and after right post-surgery and a couple months down the line. It's pretty dramatic. So just for aesthetic purposes, we want to wait to pierce and make sure that everything in the area is fully settled and fully healed. We also want to wait for safety purposes. We don't want to risk potentially an infection or bacteria from your piercings being able to get into the capsule of the breast implant and potentially causing infection, irritation, problems with the healing process. It is not worth the risk. You've just spent so much money to get beautiful implants done. You spent so much time and energy and effort recovering. Let's not ruin it all for body piercing. So 1 year minimum is my timeline for piercing someone post breast augmentation. And that's just from my personal experience as a piercer and working on a lot of augmented nipples, but also surgical and medical research about how long it takes the body to fully heal from this procedure and when the implants are fully settled and at rest so that we can appropriately place the piercings. Now, if you note at the beginning of this video, I said most of the time they're not doing too much with the nipple on breast implants. That's not all of the time. So there are a lot of forms of breast augmentation where there is a direct effect on the nipple, and that can really affect how we pierce. So some procedures that affect the nipple may be added on to the process of getting an augmentation done. For an example, one of the most popular combo procedures is a breast augmentation and a lift, when folks feel like their breasts sit a little saggy or a little too low and they want everything to be lifted up and perkier afterwards. This also usually includes making an incision and lifting the nipple to make it a little bit higher, and many folks may even have their nipples resized as a part of this process. Some clients want them to be a little bit smaller, and other clients want them to be a little bit larger. So this means that there can sometimes be quite a bit of scarring around the nipple itself. The nipple may be completely relocated. Most often we see this as a T-lift or a lollipop incision, where they make an incision underneath the breast, but they also make an incision vertically up and then cut around the nipple. Generally, they're leaving the nipple stalk intact, so we still have primary blood flow to the nipple. We still have a lot of nerve endings to the nipple. This tends to be the least impactful when we talk about being able to pierce afterwards, but they cut all of the tissue off and then they relocate the nipples to a better place on your new breasts. So this creates a lot of scarring. It can definitely affect blood flow to a certain extent. And if you've had anything where their surgeon is making incisions around the nipple, you really want to wait, again, at least 1 year before we consider piercing. But I've seen some clients who at the year mark still had a lot of density in their scar tissue and were still very much actively going through a lot of healing. And we ended up needing to wait like another full year and also doing topical scar treatments like Mederma and bio oil and silicone scar patches to get the tissue healthy enough that it could handle having a piercing. Because the concerns with nipple piercings, even on unaltered anatomy, is migration and rejection. And this can leave some pretty serious scars if it occurs. So it would suck to spend all of that money and all of that time and energy and effort getting your breast augmentation and healing it and having it be beautiful just to get piercings that migrate and reject and leave you with really serious scars on your nipple. I don't think you want that. Piercers don't want that for you. That's why we ask you to wait. Now, a commonly reported side effect of procedures for breast augmentation that involve the nipple are nerve damage and scarring that prevents the nipple from being able to become erect. So nipples, when they're at rest, sit in their flattest position, but then if you walk out into the cold, if you're excited, if you're having a good time, that tissue can kind of rotate and twist forward and become erect. That movement plays an important role in the function of our nipples. So if you have scar tissue buildup from getting augmentation done, or if there is enough back pressure put on your nipple because you've gotten very, very large implants. I usually see this in clients who have gone for 2 or 3 rounds of implant enlargement. So they're really stretching the tissue of their breast over that implant. The nipple no longer has those shape changes. The tissue doesn't respond the same way. And sometimes it's not viable for it to be pierced. If the scar tissue is too dense or if there's too much back pressure from the implant, that can cause things to, again, want to migrate and reject and push forward. Also, sometimes depending on how large the implant gets, it flattens out the nipple because people are literally like stretching that tissue over very large implants. So there's no longer any protruding nipple for me to pierce. So if you do have scar tissue buildup and it's enough to cause pretty serious movement or nerve changes to the nipple itself, that could be a factor for why it wouldn't be safe for us to pierce you anymore. And of course, some surgeons do full-on nipple grafts during breast augmentation. If someone's dramatically moving the location of the nipple or changing the size and shape of their nipple, they may do a graft just like what they do for top surgery, where they literally remove the entire nipple from the body, shape the new breasts, and then put the nipple back on in a totally new shape and a totally new placement. And if that's the case, everything I've talked about with nipple grafts for masculinizing top surgery applies here as well. 1 to 2 years, usually more like 2-year minimum. There has to be enough protrusion for us to be able to pierce through. There has to be enough blood flow, and there has to be minimal enough scarring. And my statistic of like about 50% of grafted nipples are not able to be safely pierced goes for augmentation as well. So if you are having a full graft done as part of your augmentation procedure, understand that there is a pretty high likelihood that it's not going to be safe for us to pierce you afterwards. And for what it's worth, piercers don't say no to like be mean or discourage you or disappoint you. We say no because we want you to have healthy, safe, successful piercings. We don't want you to have piercings that cause problems or damage your beautiful surgical results or anything like that. So I understand it can be very disappointing to have a piercer tell you that your anatomy is not suitable for piercing or that you need to wait longer than you originally expected, but we say it because we care and we really want to make sure that you're getting healthy, safe piercings that you can have for the rest of your life. Now, of course, I can't talk about nipple piercings and augmentation and not talk about what happens with existing nipple piercings, because many times folks are like, well, what if I already have my nipples pierced? What then? And in a lot of times, you may be able to keep your piercings. Now, you're gonna have to remove them for the actual surgery, and you're probably gonna have to leave them out for most of recovery. But if you've had your piercings for at least a couple of years, and they're very well healed and well established, there's a really good chance that they may just shrink really small, and we, with professional tools, can reopen them and get jewelry back in afterwards. Now, that is only a chance, it's not a guarantee. I definitely see plenty of people whose nipple piercings close during surgery, which also kind of makes sense. They're literally cutting apart and digging around inside your boobs. Your piercings might close. That's like kind of a risk and a side effect of this type of procedure. But more often than you might expect, I'm able to reopen them. Now, if you're just having implants put in and they're not doing anything to your nipple, there's a good chance we'll reopen them and they'll be great and fine. But if they are doing anything that involves relocating or reshaping the nipple, your doctor might not put the nipple back on exactly the way that it was before. So I've had clients who had nice parallel nipple piercings and went in and got augmentations and had the nipples resized. So the doctor did a lollipop incision and everything was still connected to the nipple stalk, but he resized and reshaped the nipple and put it on in a new place. And she came in and I was like, oh, your piercings are still open. Like, this is great. We can just taper them back in. And what we tapered back in was this. Her doctor had put her nipples back on not the exact same way they had been on her body before surgery. One nipple was like nearly 180 degrees, like the piercing was now almost vertical, and the other nipple was at like a really funky diagonal. And so we tapered them back open and put the jewelry in, and she got up and looked in the mirror and went, just kidding, take those out. I don't like how those look. We're gonna let them heal and redo them. And this happens more often than you expect. Like, the internet is full of people talking about how their doctor put their nipples back on like upside down or backwards or like sideways. And the doctors aren't really thinking, I think, about like putting them back on exactly as they were before. They're thinking about putting them back on in the way that looks the best. So if they've reshaped the nipple and they're like, now like the nipple this way looks better, they're gonna do that for you. So you can mention to your doctor, hey, like, I have existing piercings and they're straight. Can you please put my nipples back on in the same placement so that way my piercings are still straight and I can keep them? And your doctor may be able to do that, or he may not, she may not. They may say, you know, what's going to look best is us putting it back on a different way, but it doesn't hurt to mention. But yes, fair warning, if you have existing piercings, good chance they'll close. And if they close, you know, we'll wait it out. We'll see about redoing them if it's possible in the future. Equally good chance that they do stay open and they're viable, but they're just not in the same place anymore. So that is a risk to consider when you are opting to get breast augmentation done. This is just kind of a brief little video overview to go over some of the main points. You should always confer one-on-one in person with a reputable piercer who can assess your anatomy, see what's going on, see what factors there are in piercing you, and give you a really unique answer that is specific to your body, the type of augmentation you had done, any scarring you have, and what you need to be safe. So please follow up by finding an experienced, reputable piercer to help you with this. Safepiercing.org is an amazing resource to find a really good piercer near you. All right, folks, thanks so much for hanging out and chatting, and I can't wait to sit down and talk with y'all again soon. Bye.